I'm Lisa Stafford, and I'm the moderator of the physician panel, The Future of Medicare in a Changing World. It's been a difficult year because of COVID-19, especially for seniors, many who have neglected their health care or put their routine care on hold. Joining me today to discuss the future of Medicare in a changing world is Dr. Horia DeGennaro. She's a family medicine specialist at Pioneer Physician Network, and also Dr. Gary Pinta. He's an internist and president of Pioneer Physicians. Let's start with you, Dr. Pinta. What new and innovative methods of healthcare delivery have you used, especially for seniors during the time of COVID?
Well, Lisa, it has been a very challenging time with COVID. We've had many challenges that we've been able to meet by being creative and inventive. Some of the things we've done is obviously televisits. I'm sure everybody's become familiar with that, but that was a big adjustment on the fly for us. Hadn't done much before that, but now we've become somewhat experts at that. So that continues. We've also done some parking lot testing for COVID. And we've developed some side door protocols for respiratory patients so that they don't expose anybody in the waiting room or any staff members. Another great thing we did during a lot of the COVID lockdowns was we had our care managers from Paradigm Senior Care Advantage reach out to patients in their homes and check in on them, see if they had enough food and enough supplies, and if their health was okay, and if they had their medicine. So those have been some of the things we've tried.
Dr. DeGennaro, experts fear that we're in the middle of a secondary healthcare crisis, that many seniors especially have neglected their routine care for fear of exposure to the virus. I would like to know whether or not you've seen any of that in your practice. I know there's been a rise in obesity and heart attacks in some parts of the country. Have you seen that in your own practice?
Yes, unfortunately, we are seeing a lot of people with chronic conditions such as heart failure, diabetes, just not getting the care that they are used to, and that has secondary effects. As severe and dangerous as COVID is, these conditions can be just as detrimental to patients. So we really want to make sure that we're taking care of the whole patient and looking at the whole picture.
What advice do you have to senior patients who have been foregoing their regular care?
I think the biggest piece of advice would be communication. Call your primary care doctor first. There are so many resources, so many innovative things that we're doing. We can help guide you to the appropriate level of care, but you really need to establish that communication. And I know there's a lot of fear right now, even about going to see your primary care doctor, but there are many things we're doing, such as Dr. Pinta said, the side door patients, different things we can do to help make sure people are safe and getting the care that they need. So just call us.
Dr. Pinta, he touched briefly on some of the new services that have been provided to seniors during COVID-19. Can you talk a little bit more about that, what you've done in your practice to reach out to seniors?
Yeah. So, telehealth, another key thing I think going forward is understanding the technology that people have at their fingertips. So I think seniors especially, are much more astute than we've given them credit for. And so having that ability to, use your phone to communicate, but also, something as simple as having a blood pressure cuff at home. We can help to titrate blood pressure medications if we know how your blood pressure is running. So again, that goes back to communication. As for safety, again, just enhanced cleaning services. We are wiping everything down. We are keeping our waiting rooms with social distancing, marking where people should stand, and really just spacing out seats and keeping the sick people out of the place where you could come into contact. So I think it's just made us much more aware of things like that we never really considered before. And that's effective not just for COVID, but looking into flu season and colds and everything else we deal with. We're hoping that will actually keep people healthier.
How has it changed healthcare delivery model for seniors going forward, and also for Medicare patients?
I think that it just shows where we need to continue to expand technology. I really think that's key, and monitoring the different things that we need to monitor, such as vitals, blood sugar, able to download things directly into the computer, and so we can see that real time. And I think that that's something that's here to stay. I think telehealth has always been kind of on the radar, but now I don't see it going away, and just finding how we can best use that to take care of people going forward.
Speaking of Medicare, because we're in the middle of a pandemic, it's challenging for patients to learn and get information about Medicare and their options, especially for those aging in that need that information. Dr. Pinta, can you talk about some of those options that are available to Medicare patients?
Right. Well, it is a very complex choice. There are probably a million different ways you could go. But if you break it down simply, there are a couple big choices to make. One is Medicare Advantage, and the other one is fee-for-service Medicare, which also means Medicare with a supplement. So if you go, the old tried and true was the Medicare with a supplement. And really when you look at, your choice there, Medicare has the three parts, the A, the B, and the D, okay? So if you sign up for Medicare, you get the A, then you sign up for the B, pay premiums for that, and then you have to pick a D for your medications, for your prescriptions. So all three of those you have you have a Medicare card, and then a supplement card, and then a Part D card. So they're all kind of in different silos. Medicare Advantage puts A, B, and D together. So it kind of simplifies it a little bit. You really need a broker through all of this, because of all these choices, and these choices are personal because not everybody benefits the same from these. So you want a broker who looks at both Medicare and Medicare Advantage, because you want to end up in the right spot, because there are big cost differences based on your situation. So in our practice, we did an analysis, and 70% of patients do better financially on Medicare Advantage, 30% would do better on fee-for-service. You want to make sure you're in the right bucket, that your broker does that for you. I will comment also with Medicare Advantage, there are lots of extra services you can get through Medicare Advantage that you won't get through the fee-for-service or supplement. So make sure you talk to your broker about that as well. Things like dental care, hearing aids, rides to the doctor. There's all these extra things that you can get to help supplement your health. So make sure you look through all of that with your broker.
Good advice about the broker.
Yeah.
Studies also show that over the last 10 years, there's been a growing number of seniors who are switching over to Medicare Advantage. Have you seen that at Pioneer? And can you talk about your program that you have, your Senior Care Advantage program, a little bit, and talk about how it differs from others in the community?
Right. Well, certainly Medicare Advantage has become much more popular because of all those extras we talked about, the cost savings. So a lot of folks move over. Obviously, if 70% do better, if they have the broker that shows them the way, they often will choose that. So we have seen a big growth in that. This Paradigm Senior Care Advantage is sort of an agreement, a joint venture, if you will, between Pioneer and the insurance companies. And the beauty of that is we don't usually partner very well over time. It's just not something that's been good over time. But this is different. Now we're kind of working on the same team based on this joint venture, this agreement between us project. We now can work together. And the net effect for the patients, on top of all the other things I told you about with Medicare Advantage, is with Paradigm Senior Care Advantage, we have a much bigger care team. So think about it this way. Your primary care doctor went into training to be a primary care doctor because they wanted to take total care of their patients. They want to know what's going on with them. They want to direct them to the right place. They want to keep them healthy. Unfortunately, the old healthcare system really focused more on seeing a lot of patients as opposed to taking care of these patients, because we just didn't have the ability to do anything differently. The nice thing with this is we have a much bigger team. So when I'm seeing one patient, I have one of my team members checking on some of my other patients, and we can track these patients and keep them healthy much better than we ever did. So it's really letting us become the doctors that we wanted to be for our patients.
I also understand that your practice has assembled a wide range of resources that are available to patients in selecting Medicare. Can you talk a little bit about some of the resources that you have for patients to use?
Well, we do have a sort of broker network that we tap into that directs our patients to the right pathway. through Paradigm Senior Care Advantage, there are different, and you'll learn about this going forward, different ways to hear from the health plans. So this Medicare 101s we have to discuss a lot of the intricacies of this and get you introduced. But when it becomes personal, then it needs to go to a broker.
And I guess this entire webinar that people can now listen to is a resource in itself.
Yes.
Anyway, you can learn more about Paradigm Senior Care Advantage on their website. It's paradigmseniorcareadvantage.com. I want to thank you so much, Dr. DeGennaro and Dr. Pinta, for joining us today. Now let's open this discussion up for questions from the audience.